What about the facility? Are we having the patient in the correct area? Like if this patient is immunity compromised or respiratory compromised, where do we put this patient? And then, of course, what kind of equipment did we use on the patient itself for you to start thinking about? If you are investigation or you're designing a new process, all this can help you think. This is just a model. It's for you, a tool for you to use to think. Okay? More examples, which I think you can read through. I won't run through all the other examples for human factor. And I think it's important. Some of these examples are very, very relevant. They're all published papers, by the way. So you can see they're all published papers. So please get hold of the slides from HAI. So one of those things that they do in terms of HFE consideration and some of the studies that identify work system hazard in cardiovascular ORs, for example. What did they identify? Categorize the work system hazards. So how do they categorize them? They define everything. And then they propose what are the new solutions. People have actually done the steps that I mentioned earlier, and they are similar fashion as what we want to do in reaching that total system approach fashion. So there are papers that people have done so. This is not a theory or a concept that people have not done. It has been done, it has been practiced, people have published them. So it's very important that we use this framework to help you identify where you need to work on, right? And there are more examples to this. This is on health IT implementation, for example. It's also a published paper. You can find the paper. The reference is down here. So analysis of medication use. So we analyze, identify where the challenges are and where the task and the process is. Looking at what are the integrated system that we use, what type of tools we work on and how it's going to work. Are we using computer system to help us or not? If yes, what is it? And is there any risk of using the system to help us for medication? And what are those steps that are involved when we design that process in the system, the IT system itself? And then, of course, what about human? Sometimes systems are designed, and Stella and I has read so many of those reports where the design of the system works, but the font is, example of design, the font is very small. There's too many buttons to click, too many boxes to fill in. Sometimes people don't comply. It's a human factor design. You make it so difficult, people will not comply. Especially healthcare staff who works in the hospital and say that we are all very busy. So all these are design things that you can think about. Human factors that you need to think about. It is important to note that human factor solution relies on a thorough understanding of the problem situation. I need to read this to you because it is the most accurate statement to be made. You need to understand the actual problem of the situation. If you use a general term like, okay, I have medication error problem, so I deploy, okay, do more training, do more this, the usual thing that everybody do in medication error, then you are not as accurate as we would like you to be. You need to understand where is your medication error, what constitutes to your medication error, what are the contributing factors to your medication error. Then you can be more specific to deal with those contributing factors. Then you are trying to solve those problems that you have in medication error. If you use the generic version of things, I have medication error. Okay, do more training on the process of prescribing, transcribing, dispensing, administration, and monitoring of your patient. Let's do more training with that. Okay, I'm done. I already have a solution. You're not entirely wrong, you know. You are actually not entirely wrong. But how effective is it? Is it going to reduce your medication error? That's what I want you to think. That is why this statement is very important. Thorough understanding of the problem situation. In order to know the problem situation, you need to do a very good RCA. If your RCA only write medication error, wrong drug prescribed to patient A, full stop. What do you learn? Did you know where the error happened? The report only write like that. Yes, you prescribe a wrong medication. Yes, it's written in the report. Then I ask the question, so when prescribed, is it the prescription handwriting wrong? Or the pharmacy took the wrong medication? What is it that we not dive in? So your report in RCA has to be as detailed as possible and as comprehensive as possible. So those are things that I really need you to think about. Now we talk about system design. Sorry, you have to be fast because this one is the one slide that I will focus on in system design, and I want you to pay attention. This design is System Engineering Initiative for Patient Safety, SIPS. It's already been published. You Google, you will find this model and the detail of the model too. We have talked about the work system earlier. We talked everything about this side earlier, correct? We have considered the human when we design everything here earlier in the total system approach. Now what we want now, you have considered the human, we want to make sure that the work process is exactly what it can do based on all this consideration, and then you have to monitor the outcome. This outcome will not be achieved if your work process is not doing exactly this. Within work process, we also talk about compliance, staff compliance. Here is a tip. Anytime that when you do review or audit or assessment, self-assessment to yourself, anytime that you find that the department has a non-compliance to a process, don't just blame the human or blame the staff, please. Go think why people do not comply with the process. Is there something wrong with that process design? That is why many people do not want to comply. Go understand why there is an issue. That is what system is asking you to look for and to continuously improve them as we go along. We may not be 100% perfect when we first design them, but after when we implement them, you got to monitor this. And when you find non-compliance, please do not just punish the staff or blame the staff. That's not what we want. We want to study why. None of us work in healthcare because we want to do wrong. All of us work in healthcare because we want to help people and patients. So think about that. Some model to help you, because when you think about system, the only key area is really to either find out where the problem is. One is to use assessment. The other one is to investigate so we can learn. Okay? These are some of the models that you can look for and use for adverse event if you like to. This is a model framework that was designed. Here is the active failure. What are the other areas that contributed to the active failure? So it's a very comprehensive model that looks at every single thing that is happening in order to find the red dot. Why, what has contributed to this active failure? There's a table of questions and investigations that you can use. You can find those information from this link if you want to learn more. This is one of the example models you can think about to use for your RCA when you're working on it. Social tech model is something I want to introduce to you now. You use it or not is another point. This is because we are adopting a lot of health IT. We are trying to use hospital and say we are now smart hospital. Everybody, especially big people, like the word, we are smart hospital. So what is smart? Oh, we bring in a lot more IT and integrate a lot more high-tech equipment. That is why we are smart. We reduces the processes by using technology and automation. That is why we are smart. Yes, I don't dispute. But again, what can happen? What can be the issues? How do you find out what can go wrong? Everybody in this room are working towards quality improvement, safety. So how do you find out what can go wrong? Here are some of the tools to help you. when you look at this tool, this is a very simple, very nice model to use. They tell you to look at what is going wrong in the hardware. So everything we do here is we ask questions. But we ask the correct and relevant questions so that we find out what can go wrong. You will be creating many hypotheses as you go around the circle of items. And then you use our usual stratification model and probability to think about what can happen and what won't happen. What has a higher chance, what do not have. You need to have some model to help you move the first step. These are some of those tools that can help you think. And you don't have to create and crack your head to think about that. There is already many tools and models available out there to help you. It's whether you research it and use it or not. That's the next question. So, for example, when they are approaching it and they're creating work, how they can solve the problem and what they can do. People also have simple models. You look at this. This is not like a big model. It's like an Excel template. But they have framework categories ready, assessment, monitoring, communication. All this must come first. Then what is the work that they must do? Either from observation or contributory factor. What is the contributing factor? We need to find out. To find out contributing factor, you need to do RCA. Then you can fill in the blanks. Associate fall risk identified. This is for fall management, for example. This example is on fall management. So what is the action taken? What are the human factor and ergonomics knowledge that we need to apply? Everything is in a model form where you can think. And this is not, you can modify, you can put in your own areas where it's relevant to your work and your facility today. These are tools that is available, more examples for you, and these are all published, yeah. By the way, you can actually find them, these are all published. This is for telemetry, and another example, emergency department telemetry system. So what did they do? What did they consider? Emergency department, very important, because everything is very fast there and challenging, right? So they created all this information, no color, it's just tables, and then all these categories of information that they need. But you have to find and research and get this information out to fill in so you can analyze and you can do more of the strategy and the approach that they have, right? So consider this, if you look at all these models they're using, is really taking very serious consideration of the human. So these are all models that are published. You can find them. It's not difficult. You can use this as your reference. By all means, if you can do better with the model, please do so and later publish more papers. We also like to learn more as well. So that's about really doing the thing, using human as your primary consideration in designing everything. Then when we are approaching the system perspective, we are considering the human impacting the process and also the technology. And what must we do in monitoring? When we reach system design, when we are implementing them, monitoring is very important. One of the way, and I only know this way for now, if anybody have another way I also like to learn, please share with me. How do we know what we are doing is correct or not correct today? My earlier example, if that we assess and there's a non-compliance, that's one way, right? So other than doing assessment, how do we know that what we change and what we do in the new process is working very well with the human and is working very well for the patient? And we totally have a reduce of medication error or reduce of adverse event. How do we know? We need to do a lot more assessment. Okay, time is up. Organization safety, patient safety culture is the principle. You need everyone in the organization to support you in order to carry out those activities. Very quickly, framework and mindset equals to culture. Mindset is something as a tagline for this year's HAI forum as well, and I say this again and again. If we do not have the culture, we do not have the mindset. We need to grow this mindset of our colleagues to deal with that. the most important mindset to change or make positive is healthcare workers. That's the number one part. Proactive safety culture, I won't go into the details. My key thought for you is that everything you want to do in assessment and management and also talking about those work that we work on has to be proactive. You cannot just rely on reactive. Reactive allows us to do learning if you do a good RCA. But if not, then we have to do more proactive assessment. Okay? So, the last bit of total system safety is on advancing safety science. Basically telling us to use everything that we talk about and continuously to do everything we talked about earlier, including proper reporting, reviewing of the costs, identifying the recommended approach to new or to solutions to the problems that we have, help look at assessing what we need to assess in terms of the process and the human factor, and then continuously make changes to the work. So basically, advanced safety science is telling us to continuously do more monitoring, and importantly, profile your risks. This is a last piece that I like to really think. Not many people say that they will do this, but I like you to think seriously about this. Please profile your risks. Every single type of risk. Okay? Examples of what we do in the US, I won't go into that. We do adverse event as well. We use the same model that we used many, many years ago. And you can see we think about the people here as well. We always believe that human plays a very important role, so we've got to think about that. Okay? Profiling, one of those examples you can do, and I mentioned earlier about risk profiling. So I always ask the directors or the CEOs of the hospital, I always ask a question. Do you know what risks you have with the equipment in OT today? Do you have a book that tells you all the different risks of all the different equipment in your OT? I don't even talk about the whole hospital. Do you actually know? If you don't know, then ladies and gentlemen, then I ask a question. How do you manage something you don't know? That is why I kept saying you have to do profiling. Okay? So that's total system approach. The benefit of it, I don't think I have to say more, is reducing preventable error, increase staff satisfaction, improve performance, better healthcare outcome, enhance patient and staff safety, build a more resilient program to reduce human error itself. Okay? This one, please read. If I am correct, then you have to think, we have to think about how we need to reduce this issue. I ask everybody why you cannot do better, why we cannot do better in preventing harm. And they always say, it is not part of my work. I can only do so much. It needs more people, too many departments to interact, therefore too difficult. Resources and time availability not enough, so I cannot do this better. Conflict between policies and key performance indicator. My KPI in the hospital, my boss say I only need to do this, therefore I don't need to do more. If I do more also, I'm not going to get any extra, so what for? So all these are things that I hear from every country I go through in Asia. But this is a statement I always make to all my presentation or all my people that I meet. One person initiative starts from the very top. If you don't get the very, very top person to support, then you will never be able to move. That's number one. And always think about this. One friend's mother harm or one relative harm is too many to accept. It can be prevented. We cannot accept preventable harm. That is your culture and the mindset that we want people to have.